Well, welcome to Take the Upgrade podcast, Clara. I'm so excited to have you here today. And, I was actually just thinking about how I started following you on Instagram, and I'm pretty sure it's through She Works His Way, which we both have a great love for. I love those ladies, and I've just gotten so much value from them, and the connections as well have been amazing. So I think that's kind of how we got connected, but I just love what you share around health. And from your perspective, I just can't wait to see what, the conversation is going to be like. And I hope that our listeners can really gain something from what we're going to share. So that's my goal. And I know we both just want to help people be more well. So I would love to just get you to tell the listeners a little bit about how you got into what you do now and why you wanted to be a dietitian and kind of where your heart is with the work that you do.
Yeah. I was thinking that actually before I got in this call, I was like, how did our paths cross? And I was like, it has to be She Works This Way. Yeah. I feel like that's it. A great group of women. I love it. But let's see. So I work as a dietitian, and I really kind of got started out with a general interest in nutrition, really like the later years of high school. I was athletic growing up. I did multiple sports and things and was just active at baseline, but never really thought about nutrition and how I was eating to fuel my activity levels. Right. And then something just kind of like sparked in my head overnight. And I was like, I think I was at a friend's house and like had eaten what felt like a lot of Oreos and woke up and I was like, I feel like I could feel better than I currently do. Mm-hmm. And I don't know what it was. I think it was truly just like God's hand on my life. I don't know, but really started diving into the role of nutrition and how our food choices play a pretty significant impact on our physical health. Mm-hmm. My view is pretty one-dimensional at that time. I was only focusing on physical health because at that time, that was like 10 or 12 years ago. That was what most people focused on.
Right.
And so I got into it in that aspect and had a pretty healthy relationship with it at the start, kind of veered off into different paths and developed not so healthy relationship with food. But all this time was very interested in just like the science of nutrition. Mm-hmm. So I went to college, changed my major later in college to dietetics. Mm-hmm. When I realized like, oh, you can actually be like, a dietitian is a job that I can do and it's related to nutrition. That's really cool. I want to do it. So I graduated with my dietetics major, went on to do my dietetic internship, and then have been working in the field over the past 5 years, not 6, working in a hospital. I've been there my whole time. And just the clinical setting is different. It's a lot different than what you see maybe like on Instagram or read in health magazines. I'm dealing with patients that have a myriad of chronic conditions like diabetes or heart failure, heart disease, liver disease, kidney disease. And I just look at it, and a lot of them are things that are so often preventable by diet and lifestyle. And a lot of times I find my patients either don't have the education, like they don't have access to the education, or they don't have support from their family or their friends or their primary care provider. Maybe they just don't have that like confidence and the resiliency in themselves to actually carry forth with changes. Yeah. And so it's a whole host of different things that lead into this patient ending up in the hospital with poor health. That me as a dietitian, I tell them all the time, I'm biased. I think nutrition is a huge part of your health. Yeah. From a physical aspect, of course, but we're learning so much more that it also plays a role in like your mental, your emotional health as well, which I think is really cool to come at it holistically. And patients really enjoy that as well, because they're like, I never thought of it like that.
Exactly. I just think about, you said it's very different than what you see on Instagram. I guess like I would probably put us in the category of, we think, well, there's unlimited amount of resources out there, yes. Because like we follow so many people that are into health, and it's like, they have free, I don't know. I guess to me, sometimes it seems like, not in a bad way, but like doesn't everybody know that they should just like eat whole foods
Yes.
and have movement and like, but I guess they don't, and then I just appreciate your perspective because you see people totally on the opposite end of the spectrum and they have neglected that for years and years. Like, I know that that's frustrating, like, because it's your job in the hospital. How do you help those people? Let's start there because everybody might not understand, what your role at the hospital is. So, and also add in, what is your frustration with that as far as your limitations there?
Whew, I have a lot of limitations. But what I do at the hospital, so I am like an inpatient clinical dietitian. So I'm either like doing more like clinical things of calculating tube feeds or nutrition through an IV, which you're probably familiar with, TPN. If I'm not doing that, I might be counseling patients on eating to manage their blood sugar. Maybe they came into the hospital and realized they're diagnosed with diabetes. So I'm providing kind of that initial education of like laying the foundation of like, these are the things you need to know. It might be something for like a heart failure education or just like heart healthy eating. We have a lot of patients that come in that maybe have lost weight unintentionally, whether it be from some kind of chronic condition or cancer or just a loss of appetite, which happens a lot in older adults. So really looking to find ways to optimize their nutrition and how they're eating. The limitation is that, I mean, I only see patients while they're in the hospital. Once they are discharged and go home or to like a rehab facility, like I can't do anymore, really. And that's frustrating because I find a lot of these patients come in and they have no support outside of the hospital, or they just lack education or access to education. Maybe they don't have insurance, and so they can't go see a dietitian in the outpatient setting because they can't afford it. And so I feel limited because there's so much that I know I can provide them, but at the same time, I don't want to overwhelm them with information.
I know that's probably a hard balance, especially for somebody that really they didn't know any of this, and so it's like, you just want to like word vomit all of it on them, like
throw everything on them.
This, but it's probably hard to know where to even help them start. Like where do you try to help them start? I mean, do you have certain guidelines that you have to stay in, like what the federal guidelines of heart health eating, or, you know what I'm saying? Like all those guidelines, I guess.
Oh, yes. Yes. We do have some guidelines, and I don't personally align with all of them. I think some of them are a little bit outdated, and recent research shows that things like cholesterol or low fat milk is not necessarily better for you than full fat milk, or cholesterol from eggs is not actually going to raise your cholesterol, but we're still using handouts that encourage people to use low fat milk or use canola oil in place of olive oil. So that is a little bit difficult for me. I have had the ability to make some like updated handouts for use at our facility that align a little bit closely with more updated research. But honestly, for me, and what I find with talking to patients over and over and over again, kind of getting an idea of how they normally eat, most people are just not eating enough fruits and vegetables, which to us, it's like, well, how can you just not eat them? And so that is honestly what I try to focus on, whether it's, fresh, frozen, canned. How can we get you eating more of these colorful fruits and veggies? What can we add to what you're eating? Not just like telling you, cut out everything white now that you have diabetes, which so many patients have been told, and it does a disservice because then
they don't change anything because it seems too overwhelming.
Yep. Precisely.
Well, you shared a little bit on your Instagram, and that's kind of what spurred this conversation of that. These things, I'm going to quote, it says, these things aren't talked about aside from you need to lose weight or eat less and move more, or just take this pill. And it isn't even the fault of the doctor, it's the system. So what, I sometimes don't think people understand how flawed our medical system is. And that's just, I honestly think it's just outdated. A lot of it, like you said, I don't think that they're really taking into consideration current research and different things like that, especially from a dietary standpoint. But what do you feel like is the key to moving that in the right direction? I know it can seem really overwhelming, like, oh, we can't do anything, it's just how the system is. But in your opinion, you're working in it. What do you feel about that?
Yeah, I have learned, and I'm continuing to learn, being bold and using your voice to kind of, I don't want to say fight the system, but maybe just push back on it a little bit of, hey, I know that we're following this guideline, but this recent research that I have found shows otherwise. And being able to present your case. And I mean, yeah, I don't know. It's something I'm honestly still working through of like, how can I push this like nutrition supplement on a patient that's the supplement is loaded in sugar. But it's supposed to help them get better.
Yeah.
But it's got a lot of sugar in it, which sugar isn't the devil. It's not. But we know when patients are inflamed, they're already in an infected state, like their blood sugar is already going to be higher.
Right.
And I'm like, well, am I overthinking it? Am I just thinking too much into this? But then at the same time, I'm like, no, am I overthinking it, or am I just like thinking more recent compared to these outdated things that we're doing? Right. So I'm still learning, still kind of figuring out how to do it. But I think being able and being willing to speak up, and present new research and present a case for it can be super helpful to over time, if like everyone is doing that, hopefully we'll see change. And just using our voice. I've learned, if anything, like be able to use your voice.
Definitely. And not in an ugly way. We can do that in a respectful way. And so as healthcare providers, that's kind of from your perspective, but let's say from a patient perspective, what can they do to hopefully help change the system?
I honestly think, I've never been asked that before, but I think, I don't want to say demanding better care, because it isn't necessarily the physician's fault. Like we're all just working within the system, and physicians are doing the best that they can within the system, as we all are. But I think, I think it comes to using your voice and, I don't know, other than that, of just being able to stand up. I don't know if it's like calling insurance companies and hounding them.
That doesn't sound very fun.
Right. Yeah. It's those things that it's like, it doesn't sound fun. Like, is it worth even doing? I'm just one voice. But if we all continue to stand up and fight for it, and knowing that, like, I feel like sometimes the patients I see, they just, it's almost like, well, I'm too far gone. No one's going to listen to me.
That's what I was thinking. I mean, if they have all these chronic conditions, it's almost like just slap a pill on it. I mean,
Yeah. And it's like, well, what if you fought for a way to treat that condition without only focusing on a pill? I'm not anti-pill at all. I'm not anti-medication. Like there is a time and a place, but I've seen so many patients, diagnosed with pre-diabetes, put on metformin and just sent on their merry way. And I'm like, I'm sorry. This does not make sense.
No.
So like pushing back on it comes back to being willing to push back on, no, is there any other diet and lifestyle related way that I can treat this condition, or that I can manage this condition or prevent it from happening? Being willing to take responsibility of your own health is what it boils down to.
Yep. That's what I was just about to say, like not needing the system. The best way to improve it is honestly to not need it.
Yes.
Honestly, the fastest way, let's say the fastest way. But do you think people come in there and you're seeing people with lots of conditions and diseases? Do you think they think they're too far gone? Do you actually think that, that crosses their mind that they could reverse all those things? Or have they been told so many times that this is just what you're going to deal with?
I feel like they've probably just been told, like, or it's been impressed upon them that this is just, you've just got diabetes now. Yeah. Take this pill, check your blood sugar, come back every 3 months. So I think it's part of that. And then, I mean, the direct words that a lot of patients tell me, and we do work with an older population, like in their 80s. Well,
Yeah.
honey, I've been eating this way my whole life. Why,
Yeah.
why change now? And I'm like, well, I get it. I get it. I live in the South. These people have been eating cornbread and fried chicken their
Yep.
whole life. And that's what they know. And so I'm not telling them, change this cultural way that you've grown up, but, you know, you're 80, yes, but you can still have a lot of quality years ahead of you.
Right.
And think of, if you manage your diabetes, if you manage your blood pressure, how are your quality of life, how's that going to improve, so that you can enjoy, the coming years that you have without just, it can be frustrating. And a lot of what I've learned is trying to relate it to the patient and what's important to them.
Yeah, exactly. Like their
for
pain
these
points. Yeah.
For these older people, it's like, well, I really want to see my grandkids, but like, I'm too weak to pick them up. And I'm like, all right, well, what if I told you there is something that you can do that isn't within your control that would help you get to that goal of being stronger to pick up your kids? Would you be willing to consider it?
Right. Exactly. I think,
and again, it's giving them that control and handing over the responsibility to them, but letting them know that they're capable of doing it. It's not like just throwing the responsibility on you. It's like, no, you're able to do this. This is something that you have control over. And ultimately, God is in control of everything. Right. But we still have the wonderful opportunity to steward our health.
Yep.
To live to the best of our ability.
Exactly. And so, we talked about taking ownership of your health is probably the best way to avoid all of this. But so in your opinion and what you kind of live and teach, what's the best way for us to do that? If somebody's feeling really overwhelmed, like, I don't want to end up like these people that Clara's talking about. Like, I don't want to end up in the hospital with all these diseases. I mean, what could they begin doing that would help them take more ownership of their health and to steward well?
Yeah. Well, I never like to use it as like a scare tactic. Sometimes I feel like it can come across that way, which is not what I mean at all. It's just, it's what I see day in and day out. And I'm like, it doesn't have to be this way.
Exactly.
I think, gosh, one of the things that people could do, and this is coming from a dietitian, of course, but just like being more, I guess, maybe intentional or mindful of how you are fueling your body. Which can be kind of a vague statement, but I think sometimes we just kind of brush off how we're eating.
Well, you just have to, it takes forethought. I mean,
does.
if you're busy, I see you're prepping meals, you're on the go and you're making sure you have healthy meals. And I mean, it does take intention.
It does take intention. And it's kind of that cliche saying like, failing to plan is planning to fail, which it sounds so cheesy. I know, but I'm like, it is truly the most like accurate way to describe it. You don't have to have everything planned out to a T. You don't have to follow your meal plan exactly. But having some kind of like framework to use so that you can fall back on, because we are all busy. We all have other things on our plate, that we can't always like spend 2 hours in the kitchen every night. But like, if we want to improve our health and decrease our risk of having these negative conditions in the future, then it takes kind of weighing the pros and cons or the trade-offs of, okay, well, what can I do that, would be a small change? I don't have to overhaul everything, but how can I make some small intentional change? How can I plan ahead and set myself up for success? Little by little. I mean, I think of it like a snowball.
Yeah, exactly.
Start small and then it all kind of compounds on each other. And then these new habits that feel maybe overwhelming or burdensome eventually just become your normal. Like meal planning is just like, it's just a part of my Sunday afternoon. I put on some music or a nice podcast and just pound it out for an hour and a half, and then I'm done.
Yeah. And then you don't have to think about it. I mean, I know you guys don't have kids yet. You're pretty newly married. I mean, but I have kids that are now involved in a lot more sport type activities. And I mean, I just think I don't work outside of the home. So that is a luxury that I have. I can have more time to, cook at home and such, but I did work out of the home for a long time. And I just think sometimes it's just an excuse. I just, I'm busy. I don't
Yeah.
have time. I work, but I just think where there's a will, there's a way.
Mhm.
It doesn't have to be fancy. Like
Yeah.
it can be
Yes.
a lot of the same foods too. I don't think we have to
Hmm.
try these new recipes. Like just find something you like and try to make it healthier and just go with
Yes.
that.
Yes. I think we have like sometimes our expectations are just so wild. Like
Yeah.
we see all of these like really nice like
Yeah. Don't
Pinterest
get on Pinterest.
recipes.
Like
Oh my gosh,
maybe
no.
not
I
the
mean,
best idea.
we eat the same things like pretty frequently. We'll
Yeah.
rotate the same meal for a couple weeks or like having even themed nights where like Mexican Monday or
Yeah.
pizza on Fridays or something where you're removing the barrier to actually carrying out that
Right.
action. And
Yeah.
so it's making it simple. It doesn't have to be fancy dinners every night. Like you just want to be fed. And I know I talk about the plate method a lot on my Instagram where like if you are practically trying to put together healthier meals,
Mhm.
trying to have a protein, a fat, a carb, and then filling up half your plate with veggies.
Right.
Boom. You don't even have to follow a recipe. Just
Yeah.
pick one from each
Exactly.
component and get on with your life.
A lot of times that's what I do. I don't like,
Yep.
I mean, I like fancy food, but it's just not practical and my kids won't eat it. So I'm
I
like,
know. Yeah.
you just do the best
Yeah.
you can in your season.
Mhm.
I think that's so important and don't try to compare yourself to others is a big
Yes.
thing.
Yeah.
Now, I do have one question that I feel like is often one that maybe we thought previously might be a good way to improve our wellness. And that is just simply working out more and still eating junk food and still eating whatever we want, basically working out to eat all those things. I hear that a
Mhm.
lot. So what
Yeah.
is your take on that? Because I know you do have a lot of good movement, routines and things. What's your take on that?
Yeah. I mean, I think for one, just the mindset around that is so backwards,
Yeah.
and doesn't serve us in the long run because we're essentially just like punishing ourselves in a sense so that we can eat whatever we want to then
Mhm.
punish ourselves again to eat whatever we want. But more than that, like I think we can overestimate how much we are exercising or how many calories we're burning off when we're exercising. But those calories can be super easy to overconsume if we're
Yeah.
eating these traditionally thought of like junk foods,
Uh-huh.
because they're hyper palatable. They're super easy to overeat. Like if you think of them, like the foods themselves are, you barely have to chew them. Like your jaw
Yeah.
gets no workout, so it's easier to eat a lot of.
Yeah.
They have like the perfect trifecta of salt, sugar, and fat. So they
Mhm.
taste really good, and that makes it even easier to
Yeah.
overeat. And they're just not filling, like they have no fiber, they have no protein, and
Mhm.
so you're not actually getting filled up from them. So it's just kind of a backwards way of thinking. And I even think of it like if you think of our body like a car, which kind of sounds dumb, but like the fuel you put in is going to impact your body on a cellular level.
Mhm.
So a lot of times working out to burn off what you ate is more like outward or aesthetically based, whereas
Mhm.
it's totally ignoring like how the inside of your body is
Yeah.
functioning, how your cells are working, and
Mhm.
the organ and the bodily processes, like how are those functioning. Your food is more than just the calories that are in them, or
Right.
just getting to
Yeah.
eat whatever you want because you ran for an hour and a half.
Yeah. Which also isn't, it's a very big stress on your body to
Yes.
work out that hard. I mean,
Yeah.
so you have to think about that too.
Right.
Yep.
Yeah.
So, as we kind of wrap up, what would be something you'd like to leave listeners with as far as if they are feeling really overwhelmed? Because I think it's really easy to. I mean, you hear about we need to eat better, we need to do these things, but I don't know, even to the busy person, I mean, everybody just seems like they're so busy these days, and that's totally an excuse. Like where would you say would be a good place to start?
Yeah. Well, I think being willing to give yourself grace
Hmm.
and don't expect perfection. I find a
Yeah.
lot of times like we have to deal with our mindset first before we can even approach any kind of change or action.
Yeah.
Um, so kind of understanding that you're not going to be perfect. So being willing to give yourself grace in the moments when you inevitably slip up or fail,
Right.
which I use as kind of subjectively. I like to think as a failure more as just like an opportunity for feedback.
Yes.
But aside from that, like looking at your schedule and your season of life, what you feel like you're able to do, what you're willing to do, and what you're like actually ready to do, what you're ready to change. Um, and then identifying maybe one or two small changes and
Yeah.
starting there. That might be something as like simple as trying to eat more protein at breakfast. Say you're on the go, super busy, and you don't normally plan breakfast. And so you grab maybe like a donut at Dunkin' Donuts or something and a coffee.
Uh-huh.
Well, like, what if you had maybe the donut and you also had some eggs with it, or like a
Right.
thing of Greek yogurt or something?
Uh-huh.
Making the just like small changes.
Yeah.
I
That seems
we
so small, but yet it can make a really big difference in the whole grand scheme. And then
yeah,
it'll snowball, like you said.
it'll snowball and it becomes that habit. And so then you start to feel better. And then you're like, well, maybe I'll try something else. And it's like building a house brick by brick.
Yeah.
Stack all of these bricks together and you've got a really solid foundation. Whereas if you're just focusing on the latest fad or trend or something or changing everything all at once, it's
I
probably going to
agree.
crumble because you don't actually have a good foundation of those like skills that you have to have down to
Mhm.
reach that goal.
Yeah, I completely agree. And there's a lot of shame around we set these big goals or we know
Yeah.
we need to do a lot better. And then we try to just change everything. And
Yeah.
that's really not feasible for anybody, to
Yeah.
be honest. So
And then you brush off the little stuff and you're like, no, I don't need to focus on that. Like, I need to
yeah.
overhaul everything. I'm like, no, you
Yeah.
actually probably don't.
Well, you might need to, but it's
Yeah.
not going to be
Right.
very effective. So
Yes. Yes.
well, I know that you have a couple of resources, and so I'd love for you to share those about where people could just start on this. I think you have like a healthy eating type guide, so you can maybe
Yeah.
tell us about that, and then where people can follow along and just get some of this information.
Yes. So I actually did. I came out with an ebook in May of this year.
Mhm.
It's called Simple Staples, a simplified guide to eating well. It's a compilation of recipes. There's 26, I think, gluten-free and dairy-free recipes in there that are, I mean, anything from like meal prepped breakfast ideas to a simple dinner night recipe, some
Uh-huh.
snacks and stuff. And then it's also got some just really like, I think of it as practical and tangible nutrition information,
Mhm.
guidance, a little bit of kind of what we've talked on here today of like how to build a healthy, balanced meal, what to do with like emotional eating or dealing with consistency, or what do we need to know about sugar? Is it really terrible for us?
Right.
So those kind of like practical, tangible things. It's got a lot of kind of reflective questions in there as well
Yeah,
to kind
I
of,
think that's
again,
important.
piece back to your mindset and relating it to your life. So that is available on my website, which is claranorfleet.com. And then I'm also on Instagram at Food, Fitness, and Faith.
Awesome. Well, thank you
Yeah.
so much. I just hope this helps somebody just realize that you can start small and it really does make a big difference. And just to hear your
Mhm.
perspective. So I appreciate that and for you being on today and giving of your
Yes.
time.
Well, thank you, Carrie. It was such a fun opportunity, great conversation. Something I'm passionate about and love to hear and talk with other people about it as well.